Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Legal and ethical considerations. Culture strongly influences pain expression and need for pain medication. However, cultural pain, option A, may be suffered by a client whose valued way of life is disregarded by practitioners. Option B, is more intense, thus necessitating more medication. Option C, is not expressed verbally or physically. Option D, is expressed only to others of like culture. Right answer is option A, may be suffered by a client whose valued way of life is disregarded by practitioners. Nurses need not assume that pain relief is equally valued across groups. Cultural pain may be suffered by a client whose valued way of life is disregarded by practitioners. The dominant values in American society on individual autonomy and self-determination. Option A, rarely have an effect on other cultures. Option B, do have an effect on healthcare. Option C, may hinder ability to get into a hospice program. Option D, may be in direct conflict with diverse groups. Right answer is option D, may be in direct conflict with diverse groups. The dominant value in American society of individual autonomy and self-determination may be in direct conflict with diverse groups. Advance directives, informed consent, and consent for hospice are examples of mandates that may violate clients' values. In the United States, access to healthcare usually depends on a client's ability to pay for healthcare, either through insurance or by paying cash. The client the nurse is caring for needs a liver transplant to survive. This client has been out of work for several months and does not have insurance or enough cash. A discussion about the ethics of this situation would involve predominantly the principle of option A, accountability, because you as the nurse are accountable for the well-being of this client. Option B, respect of autonomy, because this client's autonomy will be violated if he does not receive the liver transplant. Option C, ethics of care, because the caring thing that a nurse could provide this patient is resources for a liver transplant. Option D, justice, because the first and greatest question in this situation is how to determine the just distribution of resources. Right answer is option D, justice, because the first and greatest question in this situation is how to determine the just distribution of resources. Justice refers to fairness. Healthcare providers agree to strive for justice in healthcare. The term often is used during discussions about resources. Decisions about who should receive available organs are always difficult. The Code of Ethics for Nurses is composed and published by option A, the National League for Nursing. Option B, the American Nurses Association. Option C, the Medical American Association. Option D, the National Institutes of Health, Nursing Division. Right answer is option B, the American Nurses Association. ANA has established widely accepted codes that professional nurses attempt to follow. Nurses agree to be advocates for their patients. Practice of advocacy calls for the nurse to option A, seek out the nursing supervisor in conflicting situations. Option B, work to understand the law as it applies to the client's clinical condition. Option C, assess the client's point of view and prepare to articulate this point of view. Option D, document all clinical changes in the medical record in a timely manner. Right answer is option C, assess the client's point of view and prepare to articulate this point of view. Nurses strengthen their ability to advocate for a client when nurses are able to identify personal values and then accurately identify the values of the client and articulate the client's point of view. Successful ethical discussion depends on people who have a clear sense of personal values. When many people share the same values, it may be possible to identify a philosophy of utilitarianism, which proposes that Option A. The value of people is determined solely by leaders in the Unitarian Church. Option B. The decision to perform a liver transplant depends on a measure of the moral life that the client has led so far. Option C. The best way to determine the solution to an ethical dilemma is to refer the case to the attending physician. Option D. The value of something is determined by its usefulness to society. Right answer is Option D. The value of something is determined by its usefulness to society. A utilitarian system of ethics proposes that the value of something is determined by its usefulness. The philosophy, sometimes called the Code of Ethics of Care, suggests that ethical dilemmas can best be solved by attention to Option A. Relationships. Option B. Ethical principles. Option C. Clients. Option D. Code of Ethics for Nurses. Right answer is Option A. Relationships. The ethic of care explores the notion of care as a central activity of human behavior. Those who write about the ethics of care advocate a more female-biased theory that is based on understanding relationships, especially personal narratives. In most ethical dilemmas, the solution to the dilemma requires negotiation among members of the healthcare team. The nurse's point of view is valuable because Option A. Nurses have a legal license that encourages their presence during ethical discussions. Option B. The principle of autonomy guides all participants to respect their own self-worth. Option C. Nurses develop a relationship to the client that is unique among all professional healthcare providers. Option D. The nurse's code of ethics recommends that a nurse be present at any ethical discussion about client care. Right answer is Option C. Nurses develop a relationship to the client that is unique among all professional healthcare providers. When ethical dilemmas arise, the nurse's point of view unique and critical. The nurse usually interacts with clients over longer time intervals than do other disciples. Ethical dilemmas often arise over a conflict of opinion. Once the nurse has determined that the dilemma is ethical, a critical first step in negotiating the difference of opinion would be to Option A. Consult a professional ethicist to ensure that the steps of the process occur in full. Option B. Gather all relevant information regarding the clinical, social, and spiritual aspects of the dilemma. Option C. List the ethical principles that inform the dilemma so that negotiations agree on the language of the discussion. Option D. Ensure that the attending physician has written an order for an ethics consultation to support the ethics process. Right answer is Option B. Gather all relevant information regarding the clinical, social, and spiritual aspects of the dilemma. Each step in the processing of an ethical dilemma resembles steps in critical thinking. The nurse begins by gathering information and moves through assessment, identification of the problem, planning, implementation, and evaluation. The nurse practice acts are an example of Option A. Statutory law. Option B. Common law. Option C. Civil law. Option D. Civil law. Right answer is Option A. Statutory law. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.